Thanks for staying with us. So the COVID cases are rising in India. Is it because of testing? Is it because lockdown has got over? How should one look into it? Because one side we can look at the number of cases, but should we be focusing on the mortality rate? The idea of the next discussion is to understand that why there is a spike, how should one understand it, while we should continue to wear masks, maintain social distancing in today's real world. When lockdown in a sense has got lifted, metros have started, public transport has picked up, how can one really understand the new spike in the coronavirus cases? India now has the second highest corona cases only after US. But remember, the population base is also very large, so this needs to be put into context. Dr. Hemant Thacker and Mr. Velumani of Thyrocare, they both join us to walk us through how should our viewers understand and interpret this entire spike in COVID cases. Good morning to both of you. Thank you for joining us. Dr. Thacker, good morning. What is your understanding on why there is a spike? Is it because of testing, or is it because of the casual attitude, and now that lockdown has got lifted, everyone is thinking that the worst is over?
Together. Definitely we are testing. It's a large country, 1.3 billion people, so we are going to see numbers. But there is a casual attitude. I'm afraid the term pandemic fatigue is something what I would like to invoke. There is pandemic fatigue. People are fed up. People want to go back to work. The healthcare facilities are thus getting strained. I think whilst we unlock, we need to keep flagging and flogging that you have to distance, you have to mask, and you have to sanitize. Unfortunately, from all stratas of society, we are seeing people not wearing masks. The casual attitude is there. In Mumbai, from the 20th to the 25th, we had even started relaxing norms, because we found that we had beds now getting available, and suddenly there is a spurt. What is worrying me is that the casual attitude has probably led to now a second wave because now we are finding people coming to hospital. We are finding a clamor for beds. We are finding people needing oxygen. And in my heart of hearts, I'm only wondering, are really we in a second wave? Are we leading to probably a mutational strain? I don't know. But be that as it may, the people, the administration have to be very, very strict with citizens who are casual about this and who think pandemic fatigue is a way of life. So we are in a delicate situation. We have to nip it in the bud. The administration has done everything. You should start either invoking fines or arresting people or telling and ticking them off very strongly if they do not have civil obedience. This is what I think.
Mr. Velumani, what is your sense? Time to focus on the good news, which is mortality rate, or should we genuinely get worried about a second wave coming?
Nikunj, we had been fighting all along only to control the infection, which is really not in our hand. We should have only focused on controlling the deaths. And death per million, even today, India is only 50 deaths per million. So in my opinion, unlocking is not wrong. We have to unlock. We had to unlock long back. It's too late, but we must right now. There is a fear in public. They know that if they are infected, it is going to be a hell for them to come back. So there is enough fear. But in my personal opinion, the spike is because we have unlocked, number one, because we are testing now more. So these two together are giving us infected per million far high as a number. But if you look at it, deaths per million is supposed to be giving us some kind of relief, and the infrastructure and the government should make sure adequate beds are there, adequate oxygenated beds are there, ventilated beds are there. As long as they are there, they are supposed to open the lid to that extent that nothing precipitates. One thing is very clear, no one can escape. It's only a matter of delay. In my personal opinion, there is more than 30%, 35% of the population already got exposed. If 35% of the population already got exposed and we have lost 80,000 people in the country so far, at the max, we will lose a 2 lakh people when the exposure is reaching to 90%. So this is my calculation. Without an exposure, there is no immunity. Without a herd immunity, there is no relief. So it has to be balanced between the percentage exposed and the death per million. That's a tough task for government, and government has to focus there. There is no way you can keep it closed and can do something in the country as to revive the economy. And in no way you can keep on penalizing everyone and terrorizing everyone. Keep a good awareness. Make sure people understand. Masking is must. Distancing is must. And they have to be more important when the beds of the hospital are fully occupied. So there should be a relay between percentage of beds occupied and the GDP. This balancing, if government doesn't do, they are damaging to either the health or the wealth of the country.
Sure. Mr. Velumani, do you also think that the big spike which has come in is also because more and more tests are being conducted? As per our understanding, about almost 10 to 11 lakh COVID tests are being conducted in every 24 hours span.
Yes, the percentage infected in the country continues to grow because X becomes 10x and 10x becomes 100x. So it's not that suddenly there is a spike. Ever since the first case came to India till today, it has been exponentially growing. We were not testing adequately. We didn't even test 1% of the population till beginning of August. Today we have almost 3.54% of the population tested. So the more you test, the more will be the number. But what has to be kept in mind is not the number of infected, which is every day growing. India is the second largest country. India has to be the second largest having the infection in terms of number of infection. I think government should have focused and should continue to focus, should give a great focus only to reduce the mortality, reduce the deaths, and not on reducing the number of infection, because that is not in the hands of anyone. Locking is a crude way of reducing the number of infection because you have to one day unlock. There has been debates across the world between the scientists and the administrators. What is lockdown? How is it logical? So let us not look at it. In my personal opinion, out of the 200 days of lockdown we had 50 days was perfectly justified. Continuing the lockdown is no way of fighting the coronavirus.
Dr. Thacker, what is your own sense, considering you do think that a second wave has come and the numbers are only going to spike up from here. Having said that, the recovery rates as well are seeing a phenomenal uptick. But do you think that we'll be back to square one, the problem that we were grappling with when the pandemic did hit the country, that the infrastructure was unable to really support the number of, cases which were spiking up?
We have a huge population. So as more and more people get tested, you're going to get more and more numbers. Now in Mumbai, we have a unique situation that a lot of the population is over the age of 50. And India is the diabetic and ischemic heart disease capital of the world. So everybody over 50 has one or two more comorbidities. So we are seeing, because of the rule that everybody has to be hospitalized or taken to a center, we are seeing a clamor for beds in the hospital. Anybody who tests positive, even if he is asymptomatic, by virtue of the new law that they have to be hospitalized or taken care of, they all have a fear and a panic in their bodies and hearts, and they want to get hospitalized. Now, I'm not saying the law is wrong. The law is to protect them. So we have to strike a balance. As Dr. Velumani said, it's like the tuberculosis bug or it's like the flu virus. We have to learn to live with it. even if we get a vaccine, because there is a mutation of this smart virus, at most the vaccine will decrease the kind of infection quantum that a patient will get or the kind of severity that will get from the patient's body. So we will all have to be gently brought into society. Sooner or later, we will all get exposed. But what we really will need to know is how slowly we can do it by protecting ourselves scientifically, correctly, and to see to it that we do not break the civil rules. You need to open the economy. I fully agree. 5 months of stagnation. But that doesn't mean that when you throw the economy open, you forget your civil rules. You want to delay the entry of the virus in your system to as late as possible. And if you are good and God is kind, you can get the virus in the form of a vaccine. India's numbers don't matter because we have a huge number. It is the severity that is important, the mortality rate that is important. And remember, 85 to 90% are going to be asymptomatic. So let's only worry about those comorbid patients who are becoming symptomatic. And we should help the healthcare authorities and the infrastructure to support those patients. And only those patients should seek hospitalization rather than just because you have tested positive, you run to a hospital. That is what we need to differentiate, because the spike in cases is a number, but the fear, the panic, the apprehension, the running from pillar to post, that is creating a lot of social unrest where people are worried, people are tweaking, there are no beds, people are saying we don't have oxygen cylinders. True, no healthcare facility in the world is geared to treat more than 1 or 2% of the population. So we have to have a delicate balance. We are treading a thin line, and when you're walking on thin ice, you have to make the rules practical. This is what I feel.
Absolutely. So, Dr. Hemanth, what would be the SOPs that individuals should follow currently? You know, in some cases where, like you mentioned, they are asymptomatic but test positive, or where they're living with other more vulnerable individuals, do they then just home quarantine, isolate, continue with those kind of measures which we've been talking about all this while? But just to remind everyone, because is the situation really any different now? Should they be doing anything differently?
More or less the same, and the symptoms are more or less the same. If you have comorbidities, but if you are asymptomatic, register yourself with your local physician, who is then registered with a local center, which is then affiliated to a local hospital. Keep a line open between the physician, the center, and the hospital. You don't have to be hospitalized. But if you are registered, if your line is open, if you are monitored by that physician, remember, a hospital cannot replace a center and a center cannot replace the physician. But one physician can look after 50 to 75 to 100 patients, at least virtually on the telephone, and keep them monitored. So the moment the physician feels there is a problem, he can switch the patient to, and things can be done. But if everybody, just by virtue of a positive report and a history of diabetes, was to rush to a center, whom are they going to admit and whom are they going to turn away? So some sort of system, if there is, this will help us to help them. I know the administration is doing a fantastic job, but there has to be some linkage if we establish. Then it makes good civic sense so that each one gets that quantum of healthcare, whether from the physician, whether from the center, or SOS from the hospitalization, so that the oxygen, the drugs, the tents, everything is properly distributed to the needy. This is what my opinion is.
All right, we're going to let you go on that note, Mr. Velumani, as well as Dr. Thacker. Thank you so much for taking time out and joining in, giving us a view as to how we can really look to curb the pandemic that's fast spreading in India and the measures that one needs to adopt.